When an agent meets with a consumer on Medicare Advantage, they really need to understand kind of where to start, in terms of the benefits that most impact the choices. So three things I want to kind of talk through with you this morning as kind of things I think are kind of like the key drivers, like really the best starting points, are premium, key providers, and prescription drugs.
Definitely.
Good morning, insurance agents of the senior market. Welcome back here to Near and Far. It is Friday, TGIF, Friday morning, March 24th. Glad to be joined by Chris Holmes, agency manager. How you doing?
Doing good this morning, Bill. How about yourself?
I'm feeling great. It's a Friday. I'm ready to rock. But hey, wanted to grab you and kind of chat a little bit, specifically because you've done a lot of personal production, kind of prior to your current role. So I thought this is something good for us to talk about. When you're talking about selling a med sup, like there aren't a lot of moving parts, like one of our favorite phrases is a G is a G.
Exactly.
And you're really getting down to price and maybe some branding or whatever, but at the end of the day, benefits are benefits. But when an agent is selling Medicare Advantage, they're complex animals. I mean, and there are many different elements for those consumers to decide on, whether it's premium or PCP or hospital copay or diabetic supplies or all of this stuff. I mean, it's not as easy of a process in selling that product, honing in on, what a consumer is going to decide on.
Absolutely. It's almost as if you're almost tailoring a plan to someone. You're trying to make sure it fits them correctly, as opposed to just giving them something that covers all the bases in a Medicare supplement. But Medicare Advantage is definitely more specific to each individual based on just what their needs are.
Yeah, and that was a conversation I had with an agent, just within the last couple of days that made me think about wanting for us to sit down and talk about this together. That, going into a Medicare Advantage sales appointment, thinking, I got to talk about everything. You got to have a starting point. And, the advice that I think that we consistently give agents here at Neishloss Fleming is that, when an agent meets with a consumer on Medicare Advantage, they really need to understand kind of where to start, in terms of the benefits that most impact the choices. So three things I want to kind of talk through with you this morning as kind of things I think are kind of like the key drivers, like really the best starting points, are premium, key providers, and prescription drugs.
Definitely. Three of those are definitely the big three, if you will. Obviously, people care a lot about their benefits, but what good are your benefits if A, you can't afford it, B, you can't see your doctors, and C, you can't get the drugs that you need as well?
Yeah, so let's jump into premium first. Premium is interesting because, I would say a number of years ago, you had, zero premium. And there were some markets that you didn't have a lot of choices. It was like, okay, everybody's at zero. And now we're seeing kind of a lot of disparity in terms of available price points and kind of menu options, if you will.
Definitely.
So thinking about it from your sales perspective, when you were working with consumers, do you think that most consumers have like their locked-in price point of this is the type of product I'm going to buy?
I would definitely say before you show up to the kitchen table, they already have a picture in their mind of what they are looking to spend, just because that's what they want to see come out of their bank accounts each month. But they definitely have an idea of what they want, but they don't really know until you show them really what is available.
Yeah, I mean, in my experience, and tell me kind of what you've seen, but I think you typically have two types of consumers. Mm-hmm. You have group number one that it's zero premium or it's nothing.
Definitely.
That it's like no matter what, if you're not showing me a zero, you might as well go home. That you've got that group, and that doesn't mean that they have less resources than maybe another consumer, but just from a value prop perspective, they kind of feel like if I'm going to Medicare Advantage, I need to get to the floor.
Exactly.
And I think the other group of people, I call them the value seekers, that, this year it may be zero because I think that made the most sense. And the next year it might be 35 because the consumer could see the value the agent was offering. Do you believe those two buckets exist? And if not, kind of what's been your perspective?
Definitely, and I can speak to you 100% that the people who want that $0 premium, they are certainly out there. They want to see what you can have that maybe they have to pay nothing for. Also, if they don't use the plan often, if they're not going to see doctors or use any of their benefits, then why not go for a $0 plan? And then you do have the other side, and I do think that the value seekers are certainly going to be a good name for that segment because they do want to see what's the best deal I can get. Is it worth it for me to pay a little higher premium to have cheaper copays and more coverage? Or is it going to be something where I just go back to the $0 plan? So yeah, it really is certainly two segments of that market.
So I'm going to give you a gambling analogy. Not that we know anything about gambling here at Neishloss Fleming, but to me, when I think about the zero premium folks and the value seekers, I think about like going and playing roulette at the casino. Because there used to be a friend of mine in this business who used to describe the zero premium consumer as risk takers and the value seekers as risk averse. And I thought, well, by that definition, all Medicare Advantage is a risk. And maybe it is compared to a supplement, but at the end of the day, I didn't like that risk taker, risk averse thing. But to me, it's like, okay, you stepped up to the roulette table. Are you the type of person that's going to put $50 down on black or red because it's kind of spreads it out a little bit? Or are you going to say, I'm putting $100 down on 17,
Exactly.
And see how it goes? Like, to me, I think the zero premium person is saying either A, I'm super healthy, or I'm willing to take whatever comes in terms of the cost sharing. Like, don't throw me the 35, don't show me the 50. I'm putting all my chips on 17, and if it hits, awesome, and if it doesn't, okay, I'll live with it. I feel like the value seeker, they're like, well, what do I think, makes me feel the best? Like, I'm still going for Medicare Advantage, I'm still going away from Med Sup, but I'm going to bet on black or red because I have a higher likelihood of feeling I'm in the game there. I mean, what do you think about that one?
I think that's a great analogy. I would have to say a lot of the consumers I have met with, they are definitely more of the value seeker, in that kind of portion of the market, just simply because everybody, like I said, they have this predisposition that you are going to show them a $0 plan that's going to work for them. However, if you do educate them on the fact that, hey, I can sign you up for a $0 plan, but here is your safety net, not really much there. But if I can give you a plan that may cost you a little more monthly, it's going to protect you in case something catastrophic does happen. So you certainly have those two people. And it really just depends on what they are looking for, I guess.
Yeah, and I mean, to me, I think it also varies by market. Like, in the Western Pennsylvania market, where the primary sales experience that you've got has been, and heck, for me too. I used to sell a little bit in Ohio and West Virginia, but it was mainly Western Pennsylvania. We've got a whole host of options, a whole host of different price points, and it's really been that way for a while. Where there are a number of markets where it was basically a zero premium market until very, very recently. So I think a lot of it depends too on the agents and the consumers and what markets they're in.
Absolutely. That's right, spot on.
Yeah, cool. All right. So the second item I wanted to talk about was providers, in terms of doctors, specialists, DME vendors, hospitals, all of that. So I think any agent who works in this business, even for the littlest bit of time, would say, yes, network is a critical part of any sales discussion. But I'm going to play a new game with you, Chris. Are you ready for the new game we're going to play?
Bring it on. Yeah,
okay, you're the first guest to play this game, so we're going to play Can You Solve This?
All right.
Yeah, so the question I've got for you to solve is, do hospital networks or doctors drive more sales?
I have lost more sales before, specifically with a product that did not have the person's PCP. Of course, whenever we're looking at hospitals, that's where you're going to go to for your more serious needs. However, your PCP, you see them far more often than you do a doctor at an emergency room. You build that connection. They are able to get familiar with what your needs are and really track your health. And so you have a really good track record in general with this specific doctor who knows what your needs are inside and out. So with me, I have always had a lot more issues whenever plans came up and did not have the PCP as opposed to the hospital system. So that's where I lay. I would have to say the PCP is more important.
Okay. I think this may be, for me, a market-dependent decision.
Okay.
And I would say in general, I agree with you that it is that feeling of familiarity with the physician, because to your point, you are seeing them way more often than you are a specific hospital facility. So I think in general, I would agree with that. That if you are talking to a consumer, that PCP in general is going to drive more sales. But certain markets where maybe you've got more fragmented hospital systems, where it's maybe more difficult for a particular carrier to have all of the hospitals and doctors. Because in Western Pennsylvania, we've got the Allegheny Health System and UPMC, which drive almost all of the activity. And, most of the plans have both. Like United Healthcare has both. Aetna has both. Highmark now has both. I mean, obviously they signed that agreement. There's not a whole lot of difference on the hospital network stuff. But, PCPs, it can really vary. Like, are they part of an actual health system? Are they a sole provider? Like, whatever. But I think in markets where you maybe have, a more fragmented hospital network system, I think it could play in. Because I would think, like, if you and I were in a sales situation, okay, and you're Chris Holmes at age 70, we're kind of talking about, maybe one plan where your PCP's in and a particular key hospital is out, and a different plan where the key hospital is in as your doctor is out. I feel like I would have an easier chance selling you on, hey, listen, I know you like Dr. Bob. You've been with Dr. Bob for a while. I'm sure Dr. Bob does a great job. But, what's Dr. Bob treating you for? He's treating you if you have a sinus infection. He's treating you if your knee's feeling a little creaky and referring you to a specialist. Those types of primary care items that aren't life or death items. Like, Dr. Bob, you could deal with Dr. Nick, Dr. Susan, Dr. Pamela. And they could probably do more or less the same job. But if you don't have XYZ hospital that is the #1 rated hospital in the city for cardiology and oncology and whatever, guess what? You can't easily replace that. I feel like, to me, if I was in that type of market, I might have a better chance on selling the health system or the hospital as opposed to dealing with the PCP. But people are attached to their PCPs.
100%. And I think that, of course, our selling experience that is primarily in Pittsburgh is going to be a lot different just because we have all these systems that you mentioned. And a lot of the carriers do include both of them inside of their networks. So I haven't ran into that as much. So that's probably why I'm always running into, well, if this plan doesn't have my PCP, then it's not for me. Yeah. Because most plans are going to have the hospitals anyway.
Yeah, I mean, Rob and I did an episode on Chicago within the last couple weeks, and I can remember points in time in Chicago where you've got, I think it's like 6 major health systems that are all in the greater Chicago metro area, and at various points in time, like every plan had 2. Some of them had 3, and you might get somebody who had 4. But then it's like, okay, I got to really think about where do I want to go? Like if I've got a significant issue. Now the networks in Chicago are more robust now than they were before, but that's an example where it's not like, oh, well, there's 4 plans that have all the major hospitals, so it's not even a decision-making point. But it does vary regionally, I think.
Absolutely.
Yeah. All right. So last item that I wanted to get into is prescription drugs.
Okay.
All right.
The fun part.
Yeah. Now we're talking about having fun with prescription drugs.
Being very, very exaggerated.
Yeah. Well, hey Chris, whatever you do from Friday at 5 p.m. till Monday morning at 8, that's up to you and Maddie and your dogs. Like that's totally your call.
Oh, great.
But I don't think of having fun with my prescriptions. Like I have my fun with bourbon. But okay. Hey, in all seriousness, so I wonder whether or not in some scenarios, like obviously if you've got a client who's got like 3 tier 4 drugs that aren't on the formulary, you're not selling that. But I think with some of these situations, where you got a consumer who's taking 5 drugs and 4 of the 5 are on the formulary, if it's a tier 1 or tier 2, is it more perception versus reality? Like in terms of how it impacts that, I'm just wondering from your experience, do you think clients have any desire to pick a plan that's got non-formulary drugs?
Yeah, I would say so, and I think a lot of that comes down to, again, obviously is it a maintenance drug that you kind of just have that the doctor recommends, or is it something that is dire to your health? Obviously those drugs, as you said, no go if they're not covered. But the drugs that are, kind of just maintenance, your tier 1s, tier 2s, and everything such as that, people seem to be more willing to, go with a plan that maybe doesn't cover all of them, but that requires you to show them the value in it otherwise as well.
Yeah. See, this is the prescription drugs portion of this, I think, is one that is really far-reaching, because I've had conversations with agents where they're locked into plan XYZ with whatever carrier, and that plan maybe has the really flashy bells and whistles line item benefits on the medical side, but they've got a really crappy formulary, and they're not kind of including how that works in the value proposition they're offering to the client. Or even if they cover them all, maybe their cost sharing is significantly higher. Maybe that, on this particular plan option, their 5 drugs, they've got 1 tier 1, 3 3s, and a 4. And somewhere else, it might be like 2 1s, 2 2s, and a 3. I mean, that's a massive difference in terms of monthly cost for the consumer. But I think other times, you might have a plan that only covers 3 of the 5 drugs, but 2 of the ones that they don't cover, it's like a $4 generic at Giant Eagle or at Meijer or whatever grocery store you utilize, or Publix or I want to say Piggly Wiggly. That's for those of you that are watching from down in the South, I love Piggly Wiggly. I just smile when I'm looking at that logo up on the marquee, like it's tremendous. But regardless of what grocery store you're going to, most of them have that kind of low cost generics where you can just get it regardless of your coverage. So, if you have a plan where, you got 2 non-formulary drugs, but they're low cost ones, what's the difference? Like, it's not really impacting your cost in any significant fashion.
Exactly, and if the rest of the plan itself works out for you and can provide you a better, safety net of your health coverage, then those low cost generic drugs that you could just get at the pharmacy regardless really is not that big of a deal in my mind. And the experience that I have, obviously people may pay just a couple more dollars for it, but again, if you're saving them, $500 on a possible inpatient hospitalization, or you're saving them $20 in their specialist visit every month, and maybe they go to them, every other month, the value is certainly there.
Yeah. So if I were just to close up prescriptions with a statement, I want you to tell me agree, disagree.
Okay.
Ready?
Let's try.
All right. If as an agent you can show appropriate value, you can work with a plan that has low cost non-formulary drugs.
I'm going to say agree.
Okay, so that's a yes. I particularly love this image. Like, I found this the other day. It's like, yes or no. I don't know.
This is the yes or no part of it.
Yeah, this is yes or no. So, and I think I agree, too, that, at least in my sales experience, when I've sat down with a consumer on an MAPD product, that, if I've got a couple drugs that are tier 1s, easy workaround. If they're 1s or 2s, that are non-formulary, if there's enough value with the plan that you can show, you're going to be out of pocket for this tier 2, but look at how much better this particular product is than the next maybe best option. You can get around that. But if you start getting into tier 3s and 4s on non-formulary, probably not going to work.
Yeah, I couldn't really. Well, we have really good agents out there, and I fancy myself to be a good agent, but I really couldn't imagine trying to get somebody to take out-of-pocket costs for something that's a tier 3 or 4.
Yep.
I just don't know if that's going to ever happen.
Yeah, I don't either. But, really when we're kind of wrapping up on these like key 3 items for agents when they're going into an MA appointment, to focus on, really in terms of premium, your key providers and prescriptions, that's really where we think the decision starts. Mm-hmm. And then if you can lock in on those items, then the rest of those benefits, are just kind of tiebreakers.
Absolutely. Yeah, I'm in full agreement with you on that.
Awesome. Okay. Well, hey, thanks for joining me this morning. It's been fun.
Well, thank you. I always love starting the Fridays here on Your Employer with you, so thank you for having me.
So are you lobbying for more Friday assignments, for Friday conversations?
Anytime you need me, I'm here for it.
Awesome. All right. Well, hey, everybody. Thank you so much for joining us this morning. We will be back with you on Monday, March 29th at 7 a.m. This has been Chris. I'm Bill, and this has been Near and Far. Happy Friday. Enjoy it.